Good morning, everyone. How are you?
Good morning.
Good.
Good morning.
How you doing?
Hi, everyone. We are live on YouTube streaming. We're streaming live on YouTube now. Just wanted you guys to be aware.
Hello?
Morning.
Hello?
Hi, Cheryl.
Good morning. We're live already?
Yes, we're live. We didn't want to have any technical difficulties today, so we just started to stream it.
Okay, in the future, I'd like for us to wait until whoever's chairing the meeting to be there, therefore we can be all of us can be in the same place when we
Okay.
start, because we never know who's watching or listening.
Okay.
Okay, or give me a text message letting me know you want to start early.
Okay.
Do I have a quorum here?
No, we haven't started yet. We just needed to push it live to YouTube early.
Is it me and you again, Nan?
Well, I'm ready.
I am too. So we're looking for Purnell and Gallagher and Sonny. Is that correct, Ashley?
Right now, Jones, Simon, and Gallagher. Correct.
Yeah, I'll plug it.
Now, technical difficulties.
No, yes.
Joe, could you text some of my colleagues if they're on their way?
Yes.
There's Councilman Jones. Mr. President, welcome.
Good morning, Cheryl. Nan, I see.
Yes, good morning.
Good morning.
We need one more person to be quorum.
No, we actually have a quorum now.
We have a quorum now, then excellent, we can
Yes.
begin. I will go ahead and begin. Good morning. I'm Cheryl Stevens, Chair of the Cuyahoga County Community Development Committee. This meeting, Monday, June 14th, 2021, is being called to order. Madam Clerk, if you would call the record, please.
On the roll, Ms. Stevens,
Present.
Mr. Jones,
Here.
Simon,
Here.
Mr. Gallagher. Mr. Gallagher is absent at the moment. Ms. Baker.
Here.
There's a quorum. Also like the record to reflect that Councilman Miller is also in attendance.
Thank you. Welcome, Mr. Miller.
Thank you.
Is there any public comment?
No, Madam Chair, no one submitted any public comment.
Okay. Have my colleagues had a chance to look at the minutes from our last meeting?
I make a motion that we accept the minutes as presented.
Thank you. Is there a second? Thank you, Councilwoman Baker. All in favor, aye.
Aye.
Any
Aye.
opposed? The minutes are approved. Next, we go to matters that have been referred to this committee. Madam Clerk.
Resolution number 2021-0149, authorizing a payment on requisition number 6403 to the Mount Sinai Healthcare Foundation fiscal agent in the amount of $800,000 for operational support for the Lead Safe Cleveland Coalition for the period May 1st, 2021 to December 31st, 2021.
Thank you. Is there a staff person who has a summary presentation to go first? Joe, we don't have a summary presentation.
No, what would the administration can give a summary of the.
And
I
who is that? Matt Carroll? Did I see you, Matt?
No, it would be Paul Hurdig.
Okay. Oh, Paul, thank you.
Good morning.
Good morning.
Madam Chairwoman, members of the committee, Paul Hurdig from the Cuyahoga County Department of Development. I am very pleased to bring forward today for your
Oh, you moved over to, you're on mute.
all right, apologies.
I'm sorry.
COVID hangover, on mute. We're very pleased to bring forward today a proposed operating support payment for the Lead Safe Cleveland Coalition. This is intended to be the first of a series of payments which will eventually reach county support of $4 million for the work of the coalition. I want to say that personally, as long as I've been working for Cuyahoga County, started as the housing manager, working to remove lead from the homes of low-income children has been one of our top priorities. The science has been telling us for many, many years that one of the main ways young children become poisoned with lead is through their homes. And we have scientists that have demonstrated to us there is really no safe level of lead. We have extensive research that shows that once the lead-safe gasoline was ended in the 1970s, the largest remaining source of this poisoning was old lead paint remaining in the homes of children. So we've known what to do for quite some time. And it's very exciting to me personally that the Lead Safe Coalition has worked to assemble major momentum among both the public sector, the philanthropic community, to really tackle this problem in a way that we believe is going to make a decisive and hopefully permanent reduction in the number of children being poisoned with lead. Our participation is only part of a planned roughly $100 million fundraise. We have received information from Emily Lundgaard at Enterprise Community Partners. There's very substantial support already committed from other sources, joining along with Cuyahoga County's support. We have a panel of experts assembled this morning to go into more detail about the overall goals and objectives of the program. What I will say is that the new element here, from my point of view, is that the city of Cleveland has passed legislation which now makes it mandatory for owners of rental property to actually remove the lead hazards from that property. This is a very significant step forward. And with that legislative step, we now have the true opportunity for a carrot and stick approach, where not only is there the stick, the legislation making this mandatory for landlords, but there's also a carrot in the form of a sizable loan fund for those landlords that want to do the right thing, but simply don't have the financial wherewithal to do what needs to be done. So as we do turn to the experts, they will be able to go in a little more detail about the overall program, what is planned, what the goals are to be accomplished in the city of Cleveland. I will note that while this is initially a city of Cleveland effort, we've had discussions with the partners of the coalition, and there's absolutely capacity and willingness to support our inner ring suburbs should they be able to pass similar legislation. There are a couple of zones outside the city of Cleveland where the data shows there are children at significant risk, and we would very much like to support those suburban communities in doing similar efforts with their legislation. There are already some countywide components of the program. There's a resource center that's available countywide. There is training available for lead workers, for contractors, for landlords themselves available countywide. There's a countywide hotline available. So we do see this as being a program that serves children countywide. Although honestly, as you'll see when we get to the presentation, the data shows the greatest amount of the problem is within the city of Cleveland. Wanting to address a question I know was asked previously, we are in the first year of what we hope will be a 5-year commitment. We do anticipate bringing forward in the budget proposal for the next 2 years, the next 2 years of support for council's consideration and approval, and sustaining this for a 5-year period. We are coming to you a little bit into the calendar year. We wanted first to make sure, as we looked at how COVID was playing out, how we recovered from COVID, how our budget recovered, that we wanted to make sure that it would be appropriate to bring this forward. It is. And we also had a little bit of a technical challenge. Even though this is a pretty straightforward item, this is a donation, it's still had to pass through our procurement system. And so we were a little bit delayed there. Nobody's fault, just the procurement system's been busy. At this point, I'd like to pause and see if the council chair or the committee chair, members of council have any initial questions for me, after which I'm going to hand it over to the panel of experts to go into more detail.
Okay, thank you. First of all, I'd like to recognize that that Council Member Gallagher has joined us. And I want to ask if any of my colleagues have questions, and that includes you too, Mr. Miller. Questions, anyone so far? No, then we'll proceed. Did you have your hand raised, Nan?
No, I'm sorry. We did hear some of this presentation in Board of Control. So
Okay.
I'm glad to see it in detail, and I'll wait for the speaker before I
Okay.
ask questions.
All right, thank you. So who's the first of your panel of experts to speak, Mr. Erdig?
Yes, Madam Chair, I'm going to flip it briefly to Emily Lundgaard, who's going to coordinate the presentation by the panel.
Good morning, Emily Lundgaard with Enterprise Community Partners here today on behalf of the Lead Safe Cleveland Coalition, joined by a number of our coalition leaders, including my boss, Mark McDermott from Enterprise, Mount Sinai Healthcare Foundation, also a fiscal agent for the coalition, in addition to a coalition leader. That's Mitch Bulk and Dan Cohn. And then finally, we're joined by Marcia Egbert from the George Gunn Foundation. So I'm going to get the slide deck up and hand things over to you, Dan Cohn, to get us started.
Great, thanks so much. And Chair Stevens, thank you again for having us, and to your council colleagues for making the time. We will make this brief because Paul did such a great job of outlining the content of our work today. Actually, Emily, if you want to just dive right into the second slide, we can get right into it. And as the chair well knows, lead poisoning is an extraordinary challenge for our community. We don't need to belabor this much, but it's important perhaps for your colleagues to know that 25% of Cleveland's kids who are tested have an elevated blood lead level before they enter kindergarten. And that's only those kids that we know of. Most Cleveland kids are not actually tested appropriately. So this is likely an underestimate, unfortunately. Early on in our process, we started this work. We started leaning into lead poisoning prevention in 2017. So this has been many years in the making, but several foundations commissioned a report with Case Western Reserve University because we wanted to understand the impact locally. There's a lot of information out there about national data and returns on investment, but we wanted to understand what this issue meant for us here in Greater Cleveland. And what Case Western Reserve found was that children who are lead poisoned, when compared to their non-lead poisoned peers, controlling for all other variables, have a 27% lower chance of being on track for kindergarten, have an up to 30% more higher likelihood of entering the juvenile justice system, are 34% more likely to be incarcerated as adults, and by the age of 23, are 53% more likely to be on TANF and 40% more likely to use homeless services. So, and among other public assistance programs, this is a huge issue. And if we tackle it, has an enormous return on investment. Again, this is no news to you all, but I wanted to just drive the point home of how important this is. Emily, would you mind switching to the next slide, please? And as Paul highlighted, this is an issue that really spreads across Cleveland. Certainly Cuyahoga County, there are areas where there are enormous challenges as well. But as you can see, these are data from Cuyahoga County in 2019. Those yellow areas indicate where up to about 20% of children have an elevated blood lead level. And these are largely between the ages of 0 and 5, as you can see at the top. There's some orange areas, of course, between 20 and 29%, and then those few red areas where more than 30% of children to this day in 2019 have quite high levels of lead in their bloodstream. I just want to point out, you'll also see the kind of crescent shape on the east side of Cleveland, as well as on the near west side of Cleveland, where we have high numbers of both immigrants and refugees, Spanish-speaking populations. These are really where the issue is concentrated. Next slide. And as Paul, thank you very much, outlined, we launched the coalition in January of 2019, but that was after more than a year and a half of partnership development and research. We actually took a group of local leaders, including our colleagues at Enterprise, including actually everyone you see here on this call, to a conference with HUD to learn about healthy housing and policy initiatives across the country. We met with dozens of our counterparts. We also spent a couple days rather, in Rochester, New York, doing a deep dive into their policy and systems change, and really wrapping our heads around everything that would need to happen in order for us to pass policy and really to move the entire system toward a proactive approach to preventing lead poisoning, as opposed to chasing after children after they've already been irreparably harmed. The coalition, I'm so grateful to say, is now more than 450 members across 120 organizations that all are focusing on one goal: improving housing conditions at scale to prevent lead poisoning. I think we can go on to the next slide. After we launched the coalition in January 2019, we worked diligently with our city council colleagues to pass, as Paul mentioned, a law that really reshaped how housing happens in the city of Cleveland. That law passed in July of 2019 and requires that all rental units built before 1978 be proactively inspected for and remediated of lead hazards and certified as lead safe prior to being rented. And so, as you can imagine, this is a huge shift in the housing industry and the housing market in the city of Cleveland. And we knew it would be such, and worked very closely with the city of Cleveland to develop a long on-ramp. So while the law passed in July of 2019, it just went into effect in March of 2021 because we needed lots of systems in place. We needed to build the workforce. We needed to build public awareness. We needed to ensure, frankly, that landlords and tenants and other stakeholders have the resources and supports that they needed in order to make this law a reality. And what you'll hear in just a moment is the work that we've done around providing those supports, compliance assistance to landlords and really to residents. The last thing that I'll mention here, just for the sake of mentioning it, that Cleveland's law is really based on a third-party system. So landlords, property owners themselves, who are, by the way, primarily low income, primarily they live within the neighborhoods where they're renting out properties. They are largely mom and pop operators, as it were. But it requires a lot of onus on property owners to go out and find inspectors themselves within the private market, to go out and find contractors or folks to make lead safe home repairs. And that's really where the Lead Safe Home Fund comes in that I know my colleagues will share here on the next slide. And I think that's it for me, but I'm happy to take it unless Mark or Marcia.
Thank you, Dan.
Okay.
Thanks, Dan. This is Mark McDermott with Enterprise Community Partners, and I'm going to talk for 3 slides about what we're calling the Lead Safe Home Fund. And would say first that when we talk about the Lead Safe Home Fund, it's not just money going out the door, but it's actually the fund that's making the services available. So it's really the first of its kind fund in the country to support across the board comprehensive support to property owners and to families as they deal with making rental properties, pre-1978 rental properties lead safe. And these were initially set up in, as Paul mentioned, as the carrot portion of the carrot and stick approach, if you will. And they are resources to make the Cleveland Lead Safe Certification Program law successful. But certainly, as my colleague Marcia Egbert will enumerate, And as Paul's already talked about, there are services that are and can be and are available outside of the city of Cleveland. So the total fund is close to $100 million over 5 years. And that fund includes the money to pay for, as we call them, our 2 administrators to carry out these 2 functions that you see listed here on this slide, and also money for grants and loans to property owners. So number 1 function is Let's Save Home loans and grants to property owners. And this is administered by CHN Housing Partners. Number 2 function, Lead Safe Resource Center, administered by the nonprofit Environmental Health Watch. Next slide, please. So on this first function of financial assistance to landlords, again, administered by CHN Housing Partners. In fact, you can see that the notice on the right is taking, the right part of the slide is taken from a notice that's gone out to thousands and thousands of property owners. That this provides, through CHN Housing Partners, financial assistance is available in the form of low interest loans, grants, and also incentives to achieve lead safe certification, which that third category often will mean helping to pay for the third-party inspectors that have already been referenced, that are landlords are required to engage directly with under the City of Cleveland law. I will say clearly that for now, this function and these resources of loans and grants and incentives are operating within the City of Cleveland. That is how it's been set up, and it's tied directly to the mandate that has been created under the city's legislation. There certainly is room in the future for expansion, but it would have to be, from our point of view, in conjunction with additional local jurisdictions having a mandate. And we know that will take some time. So for right now, these funds are at City of Cleveland, available to property owners in the City of Cleveland. Next slide, please. This Lead Safe Resource Center, as I mentioned, operated by Environmental Health Watch, provides these services. Really a one-stop shop for all stakeholders, landlords, property owners, homeowners, residents, tenants, other community stakeholders. And it really includes, how do I get through the system, right? Let's say certain navigation, extensive community outreach, including on the ground community members that are engaged and paid to be out there doing outreach, in addition to standard kinds of digital outreach that you might see. And then having available a Lead 101 education program, Lead Safe Certification 101, extensive workforce training for contractors, for inspectors, and for do-it-yourself landlords. What do you need? What do you need to know? How do you perform your function? And really growing the cadre of inspectors and contractors that can be certified under what is essentially a state EPA certification program that this works into. And then operating a Lead Safe hotline that any of these stakeholders can call into to get their questions asked and to move forward through the system in any way. And then finally, referrals to the financial assistance that I've already mentioned. All of this operated by Environmental Health Watch. And as Mr. Herdig has already mentioned, as my colleague Marcia can reference, some of these functions are already available for outside the City of Cleveland and other parts of the county. I think I'm done and would like to hand it off to Marcia Egbert from the George Gunn Foundation. Thank you.
Thank you very much, Mark. Appreciate it. And good morning, everyone. Chair Stevens and members of the committee, thank you so much for having us. I'm Marcia Egbert with the George Gunn Foundation. I I do have the privilege of chairing the Resource Development Committee, but it is the very definition of a team effort. And so I'm thrilled to be able to report this morning, and you see there on the bar in front of you that we have secured $42.2 million in pledges, awards, approvals, 34 million plus of which is in the bank, and 8 million of which is in process but fully pledged. So, we want to make sure that we're sharing all the information with you about how genuinely diverse the range of funding partners is in this mix. So you'll see on that bar the different shades representing different types of investments. Of course, the green highlight, we are thrilled to be able to include the county as among that essential partnership, but also, we have other levels of government. I know you're familiar with the fact that the state of Ohio, we're our first dollars in, but we are rounding third and heading for home in the state biennial budget process, where we, knock on wood, knock on everything, expect another $2 million to make it through the final stage of that process. So far, so good. We're keeping a very close eye on that with our champions, Senator Matt Dolan and Senator Nikki Antonio in particular at this point, along with our House delegation members. And then also with the city, of course, with their $5 million investment. And then a range of nonprofit and for-profit banks. So nonprofit banks like CIP and Village Capital Corporation. We have a suite of our local for-profit banks. So PNC and Huntington and Key coming together as part of the loan fund as well. A broad range of nonprofit philanthropic partners, which we are thrilled to be a part of at the Gunn Foundation, but really led by Mount Sinai and the Cleveland Foundation, the Mandel Foundation, so many others. And then an actually intriguing investment from CareSource. So as you may know, the largest Medicaid managed care organization in the States, stepping into what they think of as investing in prevention and in the social determinants of health, and seeing housing as one of those critical determinants. So it's exciting that we're trying to reach out beyond what we might think of as the sort of first tier, most obvious partners, and then expanding our reach into the corporate sector now as well. A lot of these processes were marked by strict timeframes, so that sort of guided what we pursued when and how. So of course, our public sector partners, you each have your distinct budget processes that really wait for no one. We understand that. Same with the state and city, same with philanthropic partners. And so we've just we hope, methodically moved through the levels of kinds of partners to get to the place where we are today. But of course, we've got a long way to go. So as my colleagues sort of outlined already, the fund is already enabling great work. We absolutely wouldn't be where we are without these partner investments, as I've mentioned. But now looking ahead to the next stage, we can skip to the next slide. Thank you. We want to make sure that you're feeling comfortable with how the LeadSafe Fund investments from the county will be used. So you can see these 4 bullet points here. My colleagues and Mark in particular started to outline that a bit. We are absolutely able to move full speed ahead with implementation. We have, as Mark noted, the policy framework is in place with the LeadSafe certificate mandate in the city. We have the administrative infrastructures now in place between Environmental Health Watch overseeing the Resource Center and CHN Housing Partners overseeing the LeadSafe Home Fund. We have the Community Resource Center fully up and operational, which we think is core to the county's early stage investment and benefit. So now the really significant work that remains in launch is getting those adequate dollars in to make sure we fully animate each of these types of opportunities. So the Lead Safe Toolkit and technical assistance that's available absolutely countywide to all types of partners, whether you're a landlord, you're a tenant, you're a nonprofit social service provider, you're an other kind of interested party. That resource is available for all. Mark mentioned the hotline, the community education. There have already been dozens of community outreach. You may see them, see folks out and about. They've got their squad sweatshirts when they go out and they're knocking on doors and really helping do community education in so many parts of our community. And then last but certainly not least, really highlighting this workforce development opportunity. We simply can't fully live into the potential of the legislation if we don't have an adequate workforce trained in the quality procedures to identify, help remediate, and then inspect on the back end to make sure there's compliance with the certification standards. So all of those components are operational, all fully available to the county, all where your dollars would be directed as we move into this first cycle of certification. So, I know you know this so well from so many of your investments, that our community just simply can't thrive when our children are not. And so we thank you, Madam Chair, and all the members of the committee for the opportunity to share where the work is today, where it's moving forward, and for this partnership that we think is absolutely essential to make this work and solve this problem at scale in a preventive way once and for all. So with that, I'll say thank you again and ask if there's any questions of any of our panel today.
Okay, questions, my colleagues. I'm going to.
I have a question.
Oh, certainly. Councilwoman Simon.
Thank you. Thanks for the presentation. This is exciting, especially for education and us being able to proceed with, pre-K and have the kids ready. I don't know if I'm hearing an echo, but where's the Board of Health, Cuyahoga County Board of Health in this coalition and the work being done?
Go ahead, Dan.
Oh, sure. Cuyahoga County Board of Health has been an extraordinarily strong partner. In fact, one of our colleagues, John Soboleski, was with us at the HUD conference, and Terry Allen serves as a steering committee member of the entire Let's Save Cleveland Coalition. Rebecca Dorman of Invest in Children has also been playing a leadership role on Let's Save Childcare. And there's a whole separate strategy that we've launched through our policy committee around childcare. Is Invest in Children also playing a role in testing and screening? Is that correct?
Yeah, that's right. That's the other thing I was going to add in, Dan. Rebecca Dorman and the Invest in Children team are actually formal members of the city's new Screening and Testing Commission. And actually the County Board of Health also has a formal role in that. So it's frankly, a really fantastic example of city and county partnership working in tandem on increasing lead screening and testing.
Thank you.
Okay, I know that Councilwoman Baker had a few questions.
I did, if I may, Chair.
Yes, please.
All right, I heard this presentation in part through Board of Control, and we had a few questions that have been answered. So thank you for answering some of the questions that were brought up. I guess my first question is, which is, to me, it's unbelievable that we've known that this problem has been in place for years. I mean, decades we've known about it, and we know the impact directly to children, and certainly understand the need for it, and supportive of wanting to overcome this. But for it to have, been in this that we're still talking about it in 2021 seems unbelievable. But putting that aside, what does it take to test whether or not a home has lead paint? How difficult is that?
I'm happy to take the first stab, but I'll look to my housing colleagues as well to chime in with their expertise. Councilperson, the Cleveland's lead law is built at its most basic level in terms of certification on what's called a clearance examination. And that's a two-step process for certifying a home as lead safe. So a clearance examination basically requires first a visual inspection to see if there's visibly peeling or chipping paint or other obvious lead hazards. The second is a random lead dust wipe test, and it typically is about 8 random samplings throughout a home, typically in windowsills and other impact areas where there tends to be dust created, if a door is jammed or if a window is having trouble opening and closing. That set of wipes are then sent to a third-party lab that tests the concentration of lead hazards, leaded dust within those dust particles. So for us, for the city of Cleveland, it's a bare minimum threshold. There are other more extensive tests that you can do, but evidence suggests that a clearance examination is more than sufficient to identify whether children are at increased risk for lead poisoning.
Thank you. And if I may follow on that, why is it, especially with our rental homes, why isn't it that we could not have done that preliminary visual dust test before these homes are allowed to be rented? It doesn't sound like a very extensive test. Sounds like perhaps those in the building department could come and when they inspect to make sure there's fire detectors and whatever exit signs, whatever's needed when you're using a piece of property for rental and income. Why is it that they can't include that test with their inspections before it is allowed to be rented?
Sure. Mark, do you want to take this as the policy committee chair?
Yeah, Councilman, through the chair, I'll take a stab at it. Certainly a local jurisdiction could have such a requirement. Particular to the city of Cleveland, I think, and I can't speak verbatim for the city, but we've been very involved with them on the development of the policy, and we've been very involved with the Building and Housing Department and Director Donald there on the development of the practice here. Their determination really was that, number one, they did not have the internal, we're talking about up to 100,000 units in the city of Cleveland, right? So that's a lot. But the Building and Housing Department determined that they did not have the capacity to have that expertise on staff. A local building and housing department could certainly determine that they wanted to have that expertise on staff and could get their inspectors trained and certified to conduct such tests, right? It's absolutely possible. But City of Cleveland, B&H decided that that's not what they wanted to do, and that a third party system was really going to be a better approach. Secondly, to your point of having the requirement, again, I've been working in the city on rental housing for 40 years, not for the city. So I can only speak from my perspective here because no one from the city is on the call. But I think being the only jurisdiction that has such a law on the books in the county, that the administration and council leadership in the city of Cleveland determined that it would be more onerous than they thought they could take on, given that they've never had a proactive rental. There has not been a proactive rental inspection system in the city for decades and decades. So it would be pretty onerous to try to do that. In a jurisdiction that has, final point, thank you, and I think I'm answering hopefully your question, in a jurisdiction that has more of a proactive rental inspection system as a regimen, it's quite possible that the local jurisdiction could say we could do this. I hope that helps.
It does help. I guess I wasn't looking for them to hire the specialist, and I was more so given the test criteria was so doesn't sound like it was difficult. A look, which gives you the tip that, hey, these walls look like they're peeling, could be lead, and then the swipe test that kind of seals that we've got a problem in this house. From there, it can go to the experts or whatever the city, but they flag the house and just say, like, for not having fire extinguishers or fire detectors, this house is flagged. I guess that's what I would envision a housing inspector to do, not to have the resources to fix it.
I wouldn't disagree with you, Councilwoman.
All right, my next question, if I may, Chair. In the Board of Control, I believe that it was identified that $3,500 per home is what's needed to, on the average, to rid the lead paint. Am I right about that?
Yes, that was Councilmember Baker. Yes, that's the data from the deep dive at the team at CASE's Center on Urban Poverty and Community Development, working with the city to come up with those numbers.
So with 100,000 units estimated as being a problem, the 100 million that you've estimated, are we done in the city of Cleveland if we were to raise the extra 58 million and reach that 100 million? Is this not something, of course, that reoccurs? So once it's eradicated, we're good to go. Is that fair to say?
I'll jump in, and my colleagues I'm sure will as well. So it's an incredibly fair question to ask, and one that we asked at the front end of this because there really hadn't been the ability to totally get our arms around a number. And without a number, how do you know what the scale of what you're doing is? So what you're referencing there in that close to 100,000 is sort of the raw number of all rental units. And then you start sort of moving out segments of that number for reasons that don't wind up being needing the remediation. So they're post 1978, not a lot, but that's a category. They have already done inspection. I mean, they've already sort of gone through a process and self-identified, self-remediated. That's another cohort. So there's these chunks and chunks and chunks that come out. And we've got this on a nice one pager that we're happy to share with you if you'd like that. So you can really understand what the different segments of that unit population is. That boils down to around the 25,000 units that we believe through the data dive are going to need the remediation actions that are referenced through the legislation. And so that's getting down to that number. That is the universe of working at scale to remediate to a lead safe standard in the city of Cleveland. So that's where you get the 25,000 times the roughly 3,500 to get to your $99.4 million fund. So thankfully, not nearly every unit is going to need what we're talking about, but we don't want to piecemeal the ones that do. We have to do this at scale. So.
All right, well, thank you. That's good to know. 25,000 units, 3,500 each. I mean, it gives you some beginning and an end to this process.
It does.
If I may, Chair, the grants and loans that you're considering, given that it's $3,500 and perhaps over a 3-year loan, would be a manageable number perhaps for these landlords to manage. You could go out to 5 years. But as we're loaning and then replenishing the fund, can you see some increase in revenue just by having a program that replenishes what is being loaned out so that perhaps you don't have to raise the entire 100 million?
To the councilwoman, two things on that. One, we envision the loans are being set up as 7-year loans, actually,
7 years?
In order to keep them as affordable and not push up rents in a sense, right?
Mhm.
So the return on that in our fundraising of 100 million over 5 years, the replenishing, as you accurately point out, really is not going to start building up until the later years. So we're not assuming any significant number from the replenishing coming in within those five, some will, and within those 5 years, but it certainly will be a revolving fund. Absolutely.
Well, the revolving fund after 5 years won't really be needed because this is not a reoccurring problem.
That is our hope. Keeping in mind that this is a lead safe standard, not a lead free standard, which is the approach here. And as long as properties are kind of overall well maintained and cleaned accurately, that's what we ought to see. Yes.
Okay. Can you please describe the difference between lead safe and lead free? What is it that we would keep in a home that's not safe if we're going to remediate it for $3,500?
Sure. Mark, do you want to take it or shall I? Okay. Oh, you were pointing to me. I can't tell where I am in your Hollywood Squares. Yeah, great question. So the entire system in the city of Cleveland is based off of a lead safe standard. And how that's different from lead free is as follows. Lead free typically requires what we would call full abatement. And full abatement in very old housing, which we see really spread across the city, could require, full ripping a unit down to its studs and rebuilding. I mean, replacing virtually everything. That cost can be anywhere from $10,000 to $15,000 or more. And I don't think I have to tell you, council member, that in a low value housing market like Cleveland, that is unfeasible financially for most of our landlords. A lead safe standard results in the same level of safety, relative level of safety for children, but it does not require the same intensive investment. So it could, for example, mean repainting over a surface where there has been damage. It could mean reducing friction in windows and doors or replacing a window. Actually, that's an abatement activity. You may have walked up the steps of an older home and you've seen where paint has worn away, and that would constitute a lead hazard. So rather than having to replace the entire porch, for example, painting over that surface and encapsulating where the hazard is, it still keeps children and families safe, but it doesn't necessarily require as intensive of an investment. What it does require is ongoing maintenance. And that's what this entire system is about. It's about providing supports to property owners to do these investments up front. We don't suspect that once you paint, the window wells, you're not going to have to redo that all of the time, but 2 years from now, you might have to redo that a little bit. And it won't cost you $3,500 the next time to do it. It'll be a much lesser cost, but this entire system is based on the notion that property owners have to maintain their properties and they have to do so on an ongoing basis. It still results in homes that are safe for children, but it really changes the culture around what it means to be a landlord in the city of Cleveland. And in order to assist landlords with complying, in order to assist landlords with this huge change in culture, we have to provide them some of the resources up front to make that happen, to offset some of the shock to the system. That's really the thrust of this.
Okay, well, that was informative. Thank you. So there is definitely a difference between lead safe and lead free. And this is then an ongoing program that after 5 years, you could be back trying to raise more money.
Sure. What we've seen in other cities, places like Rochester, which have seen an 85% reduction in lead poisoning over a 10-year period through very, very similar legislation, we have actually seen that their landlords do not have to, their property owners are not nearly having to invest as much the second time around. So, and we can get you these data. Don't quote me on this, but we saw early stage numbers in the low thousands, $1,500. They had a different system. They were already proactively inspecting houses for any number of hazards. So their baseline was a little bit different, but 2 and 3 and 4 years out, landlords were not having to put more than a couple $100s into maintaining their properties. Because once you do this initial investment, we're expecting that you're not going to have to repaint. You're not going to have to replace that window again. You're not going to have to reconfigure a front porch. So the idea is, of course, this will require ongoing maintenance, no doubt. But the cost to landlords should not be maintained at that level. Once you fix it up once, you just have to maintain it at really relatively low effort.
So back to the loan requirement that could replenish those dollars that is there then for those landlords to come back when they rent again, or maybe when a lease comes up, that they will have to come back to the well, but there'll be money there already because it's replenished by the loan return. on their investment. Is that fair to say?
Yeah, Councilwoman, if we're looking at out years, that's fair to say as the money starts coming back. Absolutely.
Okay. All right. Well, those are, for the most part, my questions. This is also for homes that are purchased. Am I right? Or is this just for rentals?
In the Councilwoman, in the city of Cleveland legislation, it's just for rental.
Just for rental.
That, yes.
And how many homes would you say are out there that are purchased that have lead issues that the owner, before they could sell, would need to remediate?
That's a more difficult question to answer, I'll be honest. Because again, if our data is City of Cleveland data, deep data, City of Cleveland data, and that the data is not kept for the City of Cleveland. So it's a very difficult question to answer for that jurisdiction.
Okay, thank you, Chair, for the time to ask those questions.
Thank you. Those were good questions. Mr. Cohen, did you have a question? Okay. Do any of my other colleagues have a question? Mr.
Madam Chair?
Jones?
Yes, thank you. You showed a map of the county and the high lead levels in the blood, all right, of the children. I saw the red areas being the most pronounced. I didn't catch where that was. Was that actually in Cleveland, or was it East Cleveland? Where were those highest levels of lead reflected in the map?
Sure, I can take this one. And we can maybe bring up that map a bit.
Yes, if you would bring the map up again, please.
I'm getting some feedback, I'm sorry. So if you're unable to hear me, I apologize. So the highest levels of lead poisoning happen on the east side of Cleveland in neighborhoods like Glenville, where we see historical disinvestment, no doubt. The other really high areas are on the near west side, where we see a concentration of immigrants and refugees. In fact, of the 16 or so children who were admitted to the hospital, I believe in 2017, with extremely high levels, very life-threatening high levels of lead poisoning, at least at UH, 12 of those were refugees. So these are children who are coming to the States to find refuge and are unfortunately put at risk. You'll also see that East Cleveland, one area in East Cleveland, has very, very high levels of lead poisoning as well. But you'll see the three in the kind of top right-hand corner are, as I understand it, two of the four are City of Cleveland, but the rest, there's significant concentrations throughout the city.
I think there's really two things of note here that need to be added. First is that we have, unfortunately, pretty low levels of lead screening and testing. So even when you see the numbers before you, that reflects really a small portion of our children who may have been exposed to lead. The coalition and in partnership with the county, the city, and many others, we're working to increase those lead screening and testing rates, but I think it's really important to keep that in mind as context. The other thing I'll note is any exposure to lead is hazardous to children. We know that. So when you see something like 30% or more being exposed, it's pretty staggering, because any exposure at all, even if it's that under 12% number, is still bad, right? We want there to essentially be zero exposure for children.
If that red area is the Glenville area and that general area, for those, are they going to receive special targeting? You mentioned 25,000 houses. Are they reflected in that area, or again, will there be any special targeting for those 30% or greater areas?
I can speak for a moment, Council President, on the efforts in the Glenville neighborhood. So in addition to the Lead Safe Cleveland Coalition work that's across the city of Cleveland, focusing on that lead safe certification requirement, the city of Cleveland also received about 2 years ago a substantial federal grant from HUD. It was close to $10 million, and it is for the express purpose of working in the Glenville neighborhood and nowhere else. So it's an incredibly targeted high infusion of money, and it'll do actually the lead free, the lead abatement standard. So in addition to all the lead safe services that we have available across the city and in the neighborhood of Glenville, the city of Cleveland will also be infusing $10 million into that neighborhood. So there's absolutely additional resources available there.
And just to put a finer point on it, in terms of East Cleveland, those high-risk areas in East Cleveland, that $10 million that flowed to the city was actually a collaborative effort with the county. The county also drew down, I believe it was $5 million, maybe it was $6 million. Much like Glenville, targeted in Glenville, those millions of dollars are targeted in East Cleveland. So that was a partnership. We actually hosted officials from HUD together collectively, the Let's Save Cleveland Coalition, along with City of Cleveland and Cuyahoga County, to make sure that we were drawing down as many resources for those high-risk neighborhoods as possible.
All right, well, thank you very much.
While we're on that map, I see another high-risk neighborhood. It's a yellow below the red and outside what looks like the City of Cleveland boundaries. What community is that in?
I have to be honest with you, I'm not sure. I imagine based on geography, it's a census tract within East Cleveland, but I don't want to overspeak here. Do Emily or others, do you know what those census tracts are?
I don't know these census tracts off the top of my head here, Dan, but we do have a spreadsheet from the Board of Health, because this is Board of Health data. We can supply
Emily,
that
if
to
you could
Councilwoman.
Emily, if you could look that up and tell me where I think they're mostly in East Cleveland, but that one to the southeast looks like it might be in Cleveland Heights or South Euclid. So if you could look that up for us, I'd appreciate that and send it over to us.
Of course.
Because that means that there's another community out there, and there's one down to the south end that looks like it's also outside of the city proper. So we can know which council districts have those higher levels.
Madam Chair.
Yes, Councilman Miller.
Thank you very much. I have just one question as to whether any suburban communities, to your knowledge so far, has gone so far as to introduce a compulsory lead safe remediation.
Well, you know, I have my sources of information. I do know that Cleveland Heights is discussing it and potentially will have a piece of legislation for this type of programming.
Okay, thank you.
And I think the bigger question I had was that what's necessary in the legislation for the suburban communities to participate. Daniel or Mark, can you go over that for us one more time?
To the chair, absolutely. And we stand ready the coalition stands ready to work with any jurisdiction that wants to look at such legislation. At its core, it's a question of the requirement and the nature of the requirement for property owners, targeted property owners, in whatever way that jurisdiction deems is right, and how that mandate, that requirement to make the property lead safe, how that is to be implemented. But we've learned a lot in the 2 years that we've worked on this, and actually some other jurisdictions across the country. Toledo's worked on this extensively, and we've kept in close touch with them. Detroit has. We've kept in close touch with them. We've looked at kind of what's working and what's not working in various places. So we stand ready to work with any jurisdiction in Cuyahoga County on at least what we've learned and what we would suggest.
Okay, excellent.
Madam Chair.
Yes, Councilman Miller.
Could I follow up on that last comment and ask what things have you found that don't work?
To the councilman, we certainly saw that you can expect that, without getting too deep into this, Councilman, that landlords may in fact object if they are, if rental property is targeted. Homeowners may object, right, to having to meet such a standard. So the legislation needs to be, I'm not an attorney here, but the legislation needs to be written in a way where it is not targeting or perceived to be going after any particular set of landlords or any particular locations within a jurisdiction, so that it's being applied fairly, if you will. And that's one of the lessons that Toledo learned. And so we've learned from that. Otherwise, it's really a more a matter of as council members here know, of how implementation will take place, because legislation is only as good as the implementation that's going to make it happen, right? So making sure that the infrastructure is there for implementation. Thank you.
Could I add one more lesson learned? One of the things that was so powerful about our trip to Rochester was seeing how important city and county collaboration actually was there. So they also have a model where the city passed an ordinance for proactive lead safe certification of their rental properties, but that was only possible because they also had a series of systems and investments from the county level to effectuate and, as Mark is mentioning, enforce their local mandate. They of course have a totally different kind of setup there, but the collaboration between the city and the county actually there is quite complicated because of the different political dynamics. But their coming together actually was what really made their law work.
Okay, any other questions? Councilwoman Baker?
Yes, I have another committee to leave.
Okay, but I can't let you leave right quick. So I need to close off the conversation so I can have a vote here.
I'll stay for the vote, may I just ask?
Okay, I'm going to move. I am going to cut off any other presentation by the panel so that I keep a quorum here, because Councilwoman Simon has just texted me what Councilwoman Baker said. Do I have a motion from a member of this committee? I can't hear you, Councilwoman Simon.
Madam Chair?
I could make a motion for recommendation of passage and move the legislation out of committee.
Can we do that expedited? Because I understand they verbally indicated to me prior to the meeting, they'd like to have this move through council fairly quickly.
Recommendation of suspension, second reading suspension. Thank you.
Thank you, ma'am. Is there a second?
I'll second.
Thank you, Madam Baker. If all in favor?
Aye.
Aye.
With no, any opposition? Hearing none, this motion passes. I can release my two colleagues to move on to their other meetings. I want to thank you for your attendance today. Is there any miscellaneous business? Mr. Jones, Mr. Gallagher, Mr. Miller?
If I may, Chair, before I leave.
Yes.
Will we get a report annually showing us the results of what the education has done? Because that's what we're approving today, is an educational outreach. Will we see something in a year to show us how many homes have been impacted by this legislation?
I don't know that there's a problem with that. I'm seeing Daniel shake his head, as well as Mark and Marcia. So I'm assuming they're willing to do a report. We'll just request one, and I'll send them an email afterwards to request that they follow up with an annual report.
Appreciate it. Bye-bye.
Okay. If there are no other follow-up or miscellaneous issues, I want to thank you all for your attendance and participation. And this moves forward to the full body under suspended rules so that we can expedite full approval. Thank you for your attendance. And this brings this meeting of June 14th Community Development meeting to closing. We are adjourned.